Hi everyone, going to take a look at the new OBS Navigator in Playground. We are in a simulated patient and going to go over and open up the Navigators tab. And this is the new Navigator here under Observation. This is one place, one-stop shopping for all things that you need to document on vital signs, pain, position, mobility, head-to-toe assessment, your assessments, all of these being daily charting obligations per shift. And then your admission documentation is down here as well. So let's go through this and chart on a patient. Every time you click on something, it's going to open it up here in the Navigator and you can enter it in. Obviously, vital signs would be per order, whether it's Q4, Q8, or more frequently, obviously, you could use this to document them if there was a change in patient condition. Then your vital signs are added and it will pop up in a flow sheet afterwards so you can trend them. Height and weight can be added here as well. And then weight could be added once, or it could be a daily weight if ordered. Let's say actual, and it's on the bed. And then obviously a pain score can be put in with whatever is the appropriate scale for your patient. And you can add an LDA here for the patient wherever they are stating there's pain, or if there was no pain, and their comfortable pain level would be 4. Or obviously patient off unit or patient sleeping. You can assess the pain whenever you are assessing vital signs, or more frequently, if they are complaining of pain and you are doing intervention, then you would complete your air cycle. Moving on to the head-to-toe assessment. This is going to bring you through your required assessment per shift. So we'll go into cognitive neuro. You can chart, if it's WDL, but you want to put in more detail, you can. Obviously, any pertinent abnormals. So I'm just going through this, putting that they are alert, oriented, calm, cooperative, speech is clear, and general motor response is purposeful. And I'm going to move on then to respiratory. I listen to their breath sounds. So I'm going to add that in. And they are clear and equal bilaterally. Moving on to cardiac. Was an expected. And my WDL says that's regular rhythm, S1, S2. So I can leave it at that. But obviously, if there were pertinent abnormals, I could record them. And are they on telemetry? Yes. And then you can have further telemetry documentation here. Peripheral vascular, WDL, and if they're on sequential compression device, you can add that in here. Make note of if they had any edema, and how are their extremities warm, no discoloration, no numbness, no tingling. GI, put WDL, and I listen to their bowel sounds. Their passing fleet is fine, and bowel sounds were audible and normoactive. Last bowel movement today. GU, WDL, void spontaneously without difficulty. Skin, WDL. If they did have any abnormal findings, you can find the appropriate row and or add any wounds or pressure injuries, musculoskeletal, WDL, and I can put in range of motion was performed and encouraged. And then the last in our head to toe is our safety. You could make note if they were on a bed alarm here or not, and any of your interventions related to safety. If they have, for example, aspiration screenings or aspiration precautions, bed alarms, isolation precautions, etc. So that is done Q shift. You have assessments that are also done Q shift. You have fall risk here. We'll do this quickly. And then they're not identified as a fall risk patient. If they were and had a score greater than 0, I would want to make sure that I was doing fall interventions. I'm going to put in their Braden as well. Generates a score for me. If they were at risk, I would identify interventions. And again, every time you complete one of these, it's going to show you trend. LDA reconciliation, I'm going to mark it as reviewed as I have gone through and made sure my skin was assessed for the shift and my LDAs are still needed. And so that is what is needed for shift requirement for documentation for your OBS patients. Upon admission, there's obviously more documentation that needs to be done. You have your abuse screen here. They're able to respond to abuse questions, yes or no, and then you proceed with your abuse screening, trying to identify any physical findings of abuse and if they're feeling threatened or unsafe at home. You have allergies here, which you want to mark as reviewed. If they had new allergies they made you aware of, you can add them there. AMPAC is a screening that is identifying mobility needs for our patients. And 1 through 4, it's again going to generate a score identifying if they have difficulty getting up and out from bed or up and out from a chair around their hospital room, and therefore identifying interventions if needed. The necessity of an AMPAC score for OBS patients is being discussed at the moment, so more to follow on that. Brozet, daily per shift screening for agitation. So confused, irritable, boisterous, verbal threats, physical threats, attacking objects. Again, this will generate a score for you. And if it is a score greater than 0, we would want to make sure we were putting in interventions. Care accommodation, which I'm sure you're familiar with. Patient, if they have requirements with care providers, can they do errands independently? Do they use assistive device, etc.? Your Columbia suicide screening is here. You have your depression screening here. Diarrhea, any diarrhea or loose stools within the last 24 hours. The education tab, again, is in the works at the moment. We're figuring out what the education documentation requirements will be for OBS patients, so more to follow on that. Advanced directive tab is here. Language interpreter is here. If you're using the interpreter, it gives you an opportunity to document as you do about what type of device or in-person interpreter and for what language. Meds from home is here. Did they have their own medications? Gives you an opportunity to document them and where were they disposed to. Patient valuables tab is here as well. It's an extension from starting with those medications, but then any valuables that they might have. Did they remain at the bedside? Were they secured somewhere or did they go home with someone? Your safety ID band check, how they, your ticket to ride is right here. And then obviously your social history is here to mark as reviewed with regards to tobacco use, alcohol use, drug use, sexual activity. And your travel screening is also here to mark as reviewed or put in if it is required. At certain times it is required. You can do a new screening and know if they have come into contact with anyone who is sick, any symptoms, any recent international travel. And that is your ops navigator. It is different than charting in the flow sheets, but all of this information does populate into your flow sheets. It's just a great way to be able to see what is the required documentation all in one spot.